Hi, my name is Stephen Shomo. I am a doctor of Oriental medicine and an acupuncture physician here in the state of Florida. So the idea is that Chinese medicine is based on empirical data. It's been around for centuries, thousands and thousands of years. Whereas Western medicine requires what we call a scientific proving, or saying that this does that or this does this. The idea is that that empirical data has proven that yes, these practices do work, these foods do work for that, these herbs work for that. So it's really trusting that and understanding that it is a form of medicine. Yes, it came from an Eastern culture, but it doesn't mean that it's rooted in its religious ideology. Cupping utilizes being able to suction to pull out toxins in the body, to remove stagnations. So this is where we kind of get to play with a little bit of fire. So what we're actually going to do is we're going to use a glass cup. That cup's going to create a vacuum, and we apply it directly to the skin, and it draws the skin upward. When we look at diagnosing, we always look at whether, first off, something's hot or cold. For example, when someone has a cold, they have a cough, they're producing phlegm. First question we're going to ask is, what color is it? So for example, if it's yellow, it contains heat. It might be green or yellow or gray. It means there's an infection, there's heat going on in the body. If it's more white or clear, it's more cold-natured. So we know in dietary therapies that, for example, a pear helps to clear the lungs. It breaks down that phlegm and that mucus, as does certain herbs. It starts to take the heat and penetrate down into the channels of the meridians. The base here is designed to protect the skin. We do direct moxa sometimes, or we use a stick that we apply heat to rather than just letting it sit against the skin. The biggest drawback, if you want to call it a flaw in Western medicine, is its kind of reductionist idea of really breaking down things in the body rather than looking at the body as a whole. Meaning that they have a tendency to treat more symptoms. You take a pill for this or you take something for that, rather than actually looking at the entire body, how it works together, the mental state, the physical state, and working with that and the patient as a whole.